We want to thank you for being here today, and we do want to start by thanking the Navy Child and Youth Programs for making today's webinar on school nurses supporting military-connected students within the school system possible. We do have a poll for you, and we'd like to know what is your role as an attendee today? And do we have any nurses with us today? That isn't an option in the poll, but we would like to know if you are a school nurse to let us know that you are here. And we do thank you for taking our poll. We always welcome our professionals who work with military-connected children to our parent trainings, and we do believe that you'll find the information and tips that we're sharing today very helpful. But please note that our support webinars have been designed with parents as the target audience. So before we introduce ourselves and our subject matter experts, we wanted to share a little bit more about MSEC and its mission. The Military Child Education Coalition, otherwise known as MSEC, is a nonprofit organization that was established over 26 years ago now, with the mission to support all military-connected children by educating, advocating, and collaborating to resolve some of those educational challenges that are associated with the military lifestyle. In 2005, MSEC formalized support and programming for our military-connected parents so that they may be empowered, informed, and hopefully proactive in supporting their children's educational journey. So we strive to deliver these informative and interactive webinars that address academic, social, and emotional issues associated with the military family lifestyle. Our vision, MSEC's vision, is that every military-connected child is college, work, and life ready. Couple quick administrative announcements. At the end of the webinar, we invite you to take our survey about today's presentation. We really would appreciate it if you take the 2 or 3 minutes it would require you to give us this feedback. This is a key method that we use to tell our funders what we're doing, and of course it lets us know if we maybe should modify things so we can continue offering the very best training opportunities possible for you, our military-connected families. So you will see a chat box on your screen where you can ask questions and make comments during our webinar, so please feel free to use this feature in Zoom. You should also see a PDF file, downloadable resources. This contains the resources and information, including all the links we're sharing today on the webinar. So please note, if you're joining us by phone, you won't be able to download these resources, but if you send us a private message, we will send that resource to you later, and all the resources that we have to share today. The webinar is being recorded, and you can always view the recording later if you want to review the material. Maybe you're experiencing technical difficulties, or if you want to share it. We always encourage sharing. So my name is Michelle Brashear, and I have Kim Armstrong with me in the chat box, and we are your MSEC hosts, and we are glad that you're here today. We ask you to place any questions that you have during the webinar in the chat box, and we'll save them for the question and answer section at the end of our subject matter experts presentation. And now we are truly honored to have 2 very accomplished women with us today, helping guide us in understanding the important ways that school nurses can support our military-connected students. First, we have retired Major General Margaret Wilmouth. Dr. Wilmouth is a professor at the School of Nursing, UNC Chapel Hill, having joined the facility in 2017, serving as the inaugural Executive Vice Dean and Associate Dean of Academic Affairs. Dr. Wilmouth is also a member of the North Carolina Institute of Medicine and is one of the 3 co-chairs for the Task Force of Veteran Health. Her current work focuses on health equity for military-affiliated individuals and educational equity for military children. A special focus is on those reserve-connected children in civilian-centric schools, ensuring adequate and quality programs to address their unique needs. General Wilmouth has a concurrent career in the U.S. Army Reserve, serving as the first nurse and female commanding general of a medical brigade with a responsibility for wartime readiness of all U.S. Army Reserve medical assets in the Southeast United States, including Puerto Rico. In her final assignment, she was promoted to Major General and assigned to the Office of Surgeon General of the U.S. Army, where she served as the Deputy Surgeon General for the Army Reserve. So that is our first subject matter expert. Our second is Dr. Ling. Dr. Ling has more than 25 years of experience as a family practice nurse, centering on providing functional access to ambulatory care in community settings. As an educator, she prides herself on providing innovative and rigorous curriculum and courses design and delivery for quality learning and practice outcomes. She's teaching our next generation. Dr. Ling has also led and participated in the planning, implementation, evaluation of micro and macro level population health interventions for disease prevention and disaster planning in both the federal and private sectors. She's a fellow of the American Association of Nurse Practitioners. And ladies, we are truly honored and privileged to welcome you today. And we are so glad you're sharing your experience today on a topic that really isn't discussed very often, I would tell you, within the military families. So we appreciate you and thank you very much.
Well, thank you very much, Michelle, for the lovely introduction. My name is Dr. Peggy Wilmouth, and first I'm going to apologize for sounding like I do. I seem to have gotten the cold that is going around these days. And again, I'd also like to thank MSEC for including Dr. Ling and I, and including the conversation with you about the role of the school nurse and how the school nurse can be an ally as you and your student move through the educational system. So next slide, please. So we'll talk a little bit today about school nurses and what school nurses can do in helping you and your child, and talk about a resource that we have developed for you to use with your school and with your pediatrician, and then how to navigate the school system a little bit. Next slide, please. I'm sure you all can relate to this. There are varying lived experiences of military-connected children, and some of those experiences differ whether they are a child of an active duty service member or the child of a National Guard or Army Reserve or Reserve component child. As you can tell, there's differences in terms of stability and community, exposure to the military culture and military community, where active duty families are surrounded and immersed in it. Reserve component families typically are not. Those from active duty families have access to many federally provided resources, where the reserve component family does not. Even when they are, the service member is on active duty orders, because reserve component connected families typically are not near to an installation, even if those assets are available to them, like MWR programs or the access to the MHS, military health system. Many reserve connected families cannot take advantage of those connections. The reserve component family is typically more stable, unless, of course, the service member has a civilian job that requires them to move. But the military does not require reserve component part-time service members to move. The biggest advantage in many ways of an active duty military connected child is that they have a peer group that has similar military experiences and stressors if they are co-located in and around an active duty installation. Our active duty Coast Guard family members are typically more civilian community based, so they lack that military culture enmeshment. Reserve component families, again, are spread geographically far and wide, and their child may be the only reserve connected or military connected child in their school. And so they may have a few, or if any, peers who have a family member who wears the uniform of our nation. Next slide, please. So again, in the school system, we typically think about the administration, the school counselor, and the teachers as being support systems and individuals that the family can reach out to for support. But an often overlooked individual in the school is the school nurse. So I'm going to let Dr. Ling talk about the role of the school nurse and how the school nurse can be an ally and what you can expect from the school nurse. Dr. Ling?
Thank you, Dr. Wilmouth, and really appreciate the opportunity to talk about school nurses and how they can support you and your child going forward. Um, the school nurses are a particular subset of the nursing profession, and the national organization that guides and supports school nursing is called the National Association of School Nurses, or the NASN acronym. Next slide, please. So here you see, and do not expect that I will be taking a quiz here on all of the very tiny print that is available. But I wanted you all to see and appreciate that school nursing has a framework for practice. And I'll go a bit more into those components in a minute, but the student is at the center. The framework for how nursing practice goes forward within the school setting is surrounding that student. And then there are standards and expectations that bring this all together under one umbrella. Um, Next slide, please. So this is where I'll go into a bit more detail. The purpose of school nursing is to create an environment where you have healthy children that leads to better learning outcomes. We know that with school nurses, if they are an RN in the school setting, you see test scores improve, chronic absenteeism go down, and you see overall improvement in different learning indices going forward. Now, want to spend just a second talking about what is a school nurse. Not everyone who is called the school nurse actually has an RN after their name. They're not necessarily a licensed and credentialed registered nurse. It really depends on your locality, who all is in the school, and who all is providing that care. And if you're able to go beyond basics, Band-Aids and boo-boo packs, as our nurses talk about, into really the full scope of nursing care. So with an RN falling under that national umbrella expectation of what practice looks like, there are actually 4 categories of work that they need to do. You see care coordination, both for that individual child who is coming in, who may have had an incident at recess rather, but they're also a resource if you have a child that has an IEP. They often sit in on those meetings. For your child that has a chronic health condition such as asthma or diabetes, they are there to coordinate with specialists, community resources, as well as the family to make sure that that child is healthy while they are at school. So there is a lot that goes into that care coordination. If they are seeing changes with the child as the child grows and develops, as there are different academic expectations from year to year, that school nurse then makes sure that they are reaching out to all involved parties. The nurse also is expected to play a role in community and public health. A lot of folks don't realize that it was a school nurse who first identified 9/11 lung syndrome because there was a public school located near where the Twin Towers had stood. So when you have an RN in your school, you have a trained observer who is there to continually assess not only that periodic acute need of the child, but also to assess the school community and what they need and what they see and any changes going on. These nurses are expected to contribute to quality improvement. Um, are the students who have diabetes, are they set up for success by making sure that their lunch and recess are around times where they can access their medications? Constantly looking to see where they can improve the learning environment to support all of the needs of the children. And they're expected to lead these efforts because oftentimes they are the only credentialed health professional within the school. So they need to be able to work with administration, with staff, with educators, with families, with community liaisons to make sure that these children have everything they need to succeed in school. So you can see throughout all of these different pieces where a school nurse is a tremendous ally for our military connected families. They may be the one who sees a school child who was really excelling, wasn't even really on the radar, all of a sudden having difficulties in the classroom, coming by the nurse's office, complaining of headaches or stomach aches frequently. At that point, your school RN really begins to dig in to what's going on with this child. So as you're sitting there thinking, I hope you're thinking about, does my school have a nurse? Now, keep in mind as you begin to ask that question, school nursing is, again, like I said, is different as you go from district to district, environment to environment. There is a recommendation that there is an RN available for every 750 students. That is a recommendation. It does not necessarily reflect expectations or safe staffing as we see in the hospital, but begin asking the question. Also ask who has quote unquote ownership or is paying for this school nurse. In some districts, it's the Department of Education. They may be a adjunctive employee in the school, meaning that they aren't in the same school structure. They may not be hired by the Department of Education. They may be a contractor from the health department or the Department of Health, or they may be a PRN or an agency nurse that is brought in to follow certain protocols. So as you begin to realize what the value a school nurse can bring to your student, you also need to ask some questions on who is this person and what is their preparation. Next slide, please. We've touched on a bit of these as we go forward. Who has the title of school nurse? Are they a registered nurse? Who's paying for this? What is their role within the school and the district? Who is the employer? The big final piece I want to leave you to think about as you begin to think about exploring who your child's school nurse is what is the military cultural competency of the school nurse? That can make a tremendous difference in how they are able to ascertain what the risks and benefits are and challenges facing the military connected child in school. For example, I am a military spouse. My husband has since retired now that our children are grown. But about move number 6 or 7, the youngest, who is very quiet and has some, wasn't one of those kids that was immediately out there making friends, would take some time at the beginning of the school year in a new school to kind of get the lay of the land, see who was who, what was going on. And we as parents got called in to say, they were worried about the socialization of our child. And we had to explain to them what being a military family was, that this was a learned behavior. And actually, we're seeing a lot of great progression. So we ended up having to teach them about military culture so that they could appropriately interpret the interaction of this military connected child. So that is why it is really critical to make sure that you prepare your school nurse and ask what their military experience has been. Are they military connected? Have they worked with military connected children in the past? And I would love to get to the point where we don't need to educate everyone around us, but we're not there yet. So that is something that as we begin to create allies, we need to do so in a way that builds up their knowledge. Next slide, please. Dr. Wilmouth, I'll turn it back to you.
Hey, thank you so much. So many of you may be very familiar with the military student identifier that was passed into law in 2015. It is it asks parents to voluntarily identify their child as being military connected. If that family member and their child is connected to the active duty part of the military, then notifying or identifying your child as being a military student, but military connected, then directs federal funds to those schools with active duty children. The other thing it does by identifying your child as being a military connected student is that all staff within the school can look at that LMS, whether it's PowerSchool or whatever web-based system they're using to track their children, and the school nurse can then look to see, oh, how many military connected students do I have in my school this year or in the schools that I'm covering this year, and then gives them an idea of being aware of what's going on, possibly having conversations about any particular impending deployments. That conversation could take place within the larger administrative team huddle that they have with administration and teachers to have better understand what might be coming during this school year for their military child. That's been in place for the active duty family since 2015. In 2020, the NDAA expanded or dropped the requirement or expectation that this was only for active duty, and that meaning it's now available for reserve component families to voluntarily identify their child as being military connected. There's no funding flow that comes to those schools if they have a preponderance of reserve component connected children. It's still not in the federal register, so not all school districts in the country have expanded use of the MSI for Guard and Reserve families. I happen to live in North Carolina. North Carolina has been very forward-leaning in this regard, and they do include reserve component family members, asking them to voluntarily identify their child if they're military connected. I found out from my daughter-in-law last year that they did finally include that in their school district in another part of North Carolina for my grandchildren to be identified as military connected. Their father is an Army reservist, as was I, and he was on a deployment. I will say in North Carolina, if you go in their school, the Director of Public Instruction is the one that tracks the numbers of military connected children. And if I go to the DPI website, it shows me that there are military connected students in 93 of the 100 counties in North Carolina. That's a far greater expansion of having military students in our state rather than just the 5 counties that are co-located around our major active duty installations. So having those data really does make the entire school system aware of that military connection children are everywhere. And as I've heard some folks from MSEC say, the only zip code in the United States that does not have a military connected child is the zip code that includes the DFW airport, because DFW is so large, it has its own zip code. But every other zip code in the country, you should anticipate that there's a military connected child there somewhere. So if you are a family member of a reserve connected child listening and your school district has not asked this question, please go to the school and ask why you are not being afforded the opportunity to identify your family member and your child as being military connected, because that can really help them have resources. I know when my oldest son was on the invasion force in 2003, the son at home, who was in high school, acted out a lot during that period of time that we didn't hear from my son, that he was on the invasion force. No matter how old or young a child is, they still can be affected by having a loved one in the military, in a deployment, or anywhere, even for training. Same thing when my son returned. The older son was deployed again last year as a reservist. Reserves do deploy on a regular basis. His 6-year-old son acted out in school when dad got home from his deployment. So again, having the school aware that dad was in that redeployment transition phase was helpful in helping them to understand why my grandson was acting out. So it really can benefit your child if you can be sure of the school know that you are military connected, regardless of the compo that your partner, son, daughter, spouse is in. Next slide, please. There are some resources out there. Some are available for active duty only. Some are available for everyone, regardless of compo. The Military Family Life Counselors is a resource available for those who are on active duty status in and around the active duty installations. School liaisons are there for everyone. So you would have to get online, identify your nearest active duty installation, and then identify the school liaison who would be closest to where you live. And they can then provide some assistance to the school in helping them become more military culturally competent, or any other assistance that you might need as a family member. I will say, uh, next slide. Never mind, I'll get to another point later. Next slide, please. Another resource that's available for everyone is Military One Source, which is a website that's out there. You can go and search that website, and there is a resource there for counselors for free short-term solution-focused counseling services that may be helpful during a deployment or any time for your military connected child and family. I will say the Purple Star School program, that has been a fabulous resource that really helps schools become more military culturally competent. They do not include school nurses in the cadre of support systems that should be wrapped into what it means to become military culturally competent. So I'm hoping that working with MSEC, we can expand that aperture to ensure that the school nurse is included in the preparation for school systems to become Purple Star certified and culturally competent. Because again, school nurses can be a very powerful ally to you and your family. Next slide, please. Dr. Ling?
Oh yes, so this is another resource we wanted to share with you. Dr. Wilmouth, myself, with a cadre of colleagues, particularly Dr. Alicia Rossiter, came together to put this resource together for civilian providers to take care of our military connected children, the I Serve 2 pocket card. It is really a great bi-directional tool. It can be used by nurses out in civilian communities to understand the challenges that a military connected child may be facing and how to assess for those, and then what to do with what you find. But I also find that military connected families can use the pocket card as a way to educate and begin to embed military cultural competencies. There's a QR code there that you can use to pull down this pocket card so that you can take it with you as you go forward. There are two sides to the pocket card. One goes through an overall strategy and how to care for military connected children under the iCare acronym. And then it breaks down what each one of those components of identify, correlate, ask, ready, resource, and encourage and educate what should be expected over there. It also includes questions that can be asked of parents and of the military connected child. It says for a well child acute care visit, this can be used in school systems. And I will tell you that the Virginia school system adopted the I Serve 2 pocket card, as well as the National Association of School Nurses has adopted the pocket card. Now, has this been able to flow out to every district? Not necessarily. We've talked about some of the challenges on who is identified as the nurse in your child's school, but this is a resource we want to make sure is in everyone's hands, nurses and families alike. Next slide, please. This is the second half, or the back page of the pocket card, if you will. And it really does begin to give some of that military language and cultural competence. It talks about the moving cycle. It talks about the deployment cycle. and really gives kind of a very brief crash course, if you will, on some of the military components of military life that the military connected child may be experiencing. I think Dr. Wilmouth brought up a really important point that I want to emphasize, is that it's not just having a parent or guardian who is serving in the reserves or active duty. Having an older sibling or having a sibling that is serving is also an incredibly powerful impactor and factor for military connected children. And they may not necessarily identify as military connected because that sibling that is serving may be the only person in the family who's serving. But it really, that service still impacts. And so we need to make sure that we are refining how we are identifying these children to make the appropriate resources and supports available. So this is the same QR code. You don't have to have a separate one for the two sides of the pocket card, but please feel free to download and share, as this gives you a way to talk to your school nurse and further that allyship that he or she can bring for your child in the school system. But it also, if you are connected within a school, this is something that you can use to begin to work with those military families. Next slide, please.
Okay, Catherine, can I just interject here?
Oh, please.
Before we get to questions, the Dr. Ling mentioned the National Association of School Nurses, and we have provided a resource for you on a paper that was published this year that provided some guidance for school nurses on how to engage with military children. And it also included another PDF version of this pocket card. Please feel free to use those resources and take them to the school nurse, take them and share them with those who are in the schools, so you can help them understand why it's important that they understand and pay attention to military connected children. So we're happy to have your questions now, if there's any in the chat, Michelle or Kim.
While we're waiting for those questions, Dr. Wilmouth, I just wanted to build on what you were saying right there, that the tools are only as good as they are being used, and so please feel free to take them and spread them forward. It is not that folks don't think that our military connected children are special; they just don't know how challenging and what the risks and benefits are, because that has not been their experience. So thank you for emphasizing that.
And as the parent of two military children, I've noticed that I've appreciated the nurse because I had a daughter especially who would go to the nurse's office at least once a day. And I was not aware of it. It actually came up that the teacher called me and said, I think your daughter may have some kind of a health issue. But actually she ended up getting diagnosed with ADHD, and she was bored in class, and that was an easy thing that she thought, well, they're not going to tell me no. So the nurse was very helpful in that, because she reassured me that there wasn't anything really wrong, but maybe she should get checked out. But yeah, huge in my own kids' lives. So one of the things I never ask, and I never thought to ask, is what if that school nurse isn't an RN, isn't that registered nurse? I know you also talked about having, I guess the ideal would be one registered nurse for 750 kids. I don't know that I've ever seen that ratio. It's always been, one nurse to a lot more kids. So
and the measure of its funding, and that's why, and
Okay.
they're state, local funded. So that's a reason to advocate to your state elected officials for why it's important to fund the up to the one per 750 student school nurse in the state. I will say my mom was a health aide. She was not an RN. She always wanted to be, was not. She was a health aide in Montgomery County, Maryland, and they are well trained. She was employed by the health department. She had a supervising RN. So again, I think that even though it may not be an RN, they're very compassionate and educating them, and they will engage with their school nurse. So don't shy away from engaging with whoever is in that role, but also encourage them to educate the RN who might be supervising them at a district level. Dr. Ling, you want to add to that?
Absolutely. No, that's a really great point. You work with who's available, and finding out who the structure is. You may have an RN that floats between 5 different schools. So you could have an elementary school, a nurse that hits the elementary school, middle school, and high school that your students may be going to. That's a fantastic opportunity to have a bridging understanding going forward.
I will tell one quick story. My son was in elementary school and they had one nurse and she was out for the day and he was hurt pretty badly at recess one day. Blood, needed stitches. And when my mom got there, the principal was like holding the wound shut. She said, "Where's the nurse?" So when you say things like, "Well, there needs to be," and there wasn't one that day, and I'm sure my mom would have appreciated someone that had better training to deal with that situation. Okay, let me tell you another question that someone had asked, and Dr. Wilmouth had already noted this a little bit, but for families whose only military connection is that older child, it's the younger, and so what if anything is that younger child, what do they need? Are they yeah, she said they are considered military connected, but we don't typically identify them as military connected. I know in a lot of the things that we talk about, we don't necessarily address the sibling as military connected. What are some of the things that we can do to help support that child? The child of a younger sibling of an active duty. Yeah.
I recognize that in hindsight as the mother. I would say we need to just begin to think about the broader ramifications of having an older sibling in the military and just have some sensitivity to it as a parent. I can recognize that in retrospect. I did not think a 17-year-old was going to be as acting out as he was when his brother was deployed. So I would, even though I was wearing the uniform myself, I would say it was my own naivete and lack of sensitivity to what his needs were. I will say we were in a civilian community where I had yellow ribbons around my tree and no one in the neighborhood knew what that stood for, didn't wrap arms around us at all. And so I think we've come a long way, but parent education is always important, and I'm really glad MSEC holds these sessions because I think this is a one way, one avenue to kind of get people to thinking about beyond the child, but the other children or their siblings or cousins, close family members that might be deployed, and how do we care for the whole family, not just the nuclear family.
We often talk about the fact that if a parent is deployed, let your teacher know, let the staff at the school know, because that your kid may be acting up and they can give a little more grace and understanding as to why they're doing that. But this is also obviously a situation that would be good to cue them in on.
I know
Well, and I think there's,
go ahead, Kathy.
Go ahead.
Okay.
Oh, well, I was just going to put in that, the thing about having an older sibling that is serving, that younger sibling, not necessarily growing up in a military connected household like children of reserve, National Guard, or active duty do. There's a lot more unknown with a sibling if you're not a military connected family. And so in some ways, it's even more imperative that we have discussions about what does it mean? What does a deployment mean? What's going on? So that they don't just depend on media for their information.
That can be
I would say that is the value of the Department of I guess I have to call it Department of War now. The Yellow Ribbon program that is designed for Guard and Reserve families. There is typically a pre-deployment Yellow Ribbon event. Occasionally, there's a middle one while the service member's deployed, and then a post-deployment Yellow Ribbon event. Some of these were in person. I know the Navy is now transitioning to Yellow Ribbon events being virtual. Those are really, really important opportunities for Guard and Reserve families to get a little bit enculturated into the deployment cycle and understanding what to expect pre, intra, and post deployment. I was, when I was still in uniform, I attended a mid-cycle Yellow Ribbon event, and I listened to one mother say her kindergartner was the only military connected child in their school and would sob and cry in the middle of in the corner of the room, would not do the video chat with dad who was deployed. He was not coping well, but he was the only military connected child in that school. And the school had minimal resources. And unfortunately, they could not get access to counseling for that child due to the, and this is still occurring, chronic shortage of mental health providers around the country. I had grandparents say, I am taking care of my grandchildren. We are no longer near, they're with me out in X town, not near an active duty installation. How do I get help for them? Or I've heard stories of other grandparents who moved closer to the child who might have been near an active duty installation while mom and dad or dad were deployed and they were reservist or guard, and they couldn't get onto the active duty installation because they didn't have the necessary ID card to get on base. So I think there's a whole lot of issues that we seem to, we're kind of in a quiet period right now, that the next deployment or the next massive crisis, we're going to have to reinvent or re-experience some of these hard lessons learned the last 20 years. So, but I will go back to the fact these Yellow Ribbon programs are really critically important for Guard and Reserve. And if your service member is saying, I don't want to go, you should insist on going because it's really important to understand if you're particularly a Guard and Reserve family.
And if you are active duty, you realize that before is challenging, during is challenging, and that coming home is challenging as well. So the support is needed all the way through. So
Yes.
we talk about, you talked about there's a kind of a quiet time, but what do we do right now to support those military families with domestic deployments? You know, maybe like a disaster assistance, because a lot of times they're called up to leave, you know, right away.
Well, I would also just intersect real quickly if I could. If it's the National Guard getting called up and deployed on state active duty orders, that does not entitle them to any federal assistance, does not entitle them to any military health system access. Those are if they're state active duty. It doesn't mean that the school system shouldn't still wrap their arms around you. Mom or dad is still gone, gone is gone, regardless of the benefits. But it's really important if you're the family to understand if it's a state active duty call up versus a federal active duty call up, because resources differ. Dr. Ling?
Oh, Dr. Wilmouth, that was really beautifully said. And my point was that gone is gone. So whether it is domestic, say that they are deployed across town, or overseas where they're gone across the world, they're still not coming home at night. They're still not available on demand to the family or to that child. And it can even be more confusing if it's a domestic deployment than it is for one overseas, because it's like, well, you're gone, but I can still drive by and see where you are. So why aren't you coming home? So it's really even more of a call to arms.
Well, MSEC, as you know, is a big supporter of Purple Star schools. So if I'm at a school and I know they're applying for the Purple Star designation, there's a list of things that they have to do. Would it be recommended that I go to them and I ask if that school nurse is identified as being included in the professional development portion of the requirement?
Please, please ask. I think, and I have spoken to some of the North Carolina school nursing organizations or smaller divisions here in the state, and many of them are well versed in military connected children. So, but please ask, because it's not on the checklist. And I do think it's important that we advocate for them as they advocate for our children and include them in that education.
I will say we talk about creating that a committee of support that for your school. And that I think is definitely where the nurse should be involved. Just, another asset for that school, another support, another of the web of support that school has to offer that student. So definitely make sure that nurse is included in that.
Absolutely, because that nurse can actually help the family as they remember part of their job is to do care coordination. So if you have grandparents who are now taking care of a military connected child with both parents being deployed, that point of care coordination can help access records that maybe the family can't get to, that they can sign releases for, bring that nurse on for an ally to get whatever background pieces they need. Because while theoretically medical records flow, school records flow, that in theory is how everything fits together, but we know that reality creates additional challenges and opportunities to excel. So every opportunity we can have to create one more ally in one more area, it really does benefit the children and their families.
So one of the things that MSIC promotes all the time and tries to assist people with is that transition support, moving from that one location to the next location. So it's sounding like that nurse would be a really good to have them be included in that transition support program, to add them along with your counselor and your teacher to make sure that they're involved.
Absolutely. So here's just a quick example on how that could be really beneficial. One of our moves was from South Carolina to California. Very different school systems. You would think that health requirements for each school system are the same. They are not. And sometimes, depending on where you are and what the supply chain is like to that area, you may have access to vaccines at critical times. And a military child may be coming in at what is considered an off season to meet those requirements. Having a school nurse there to say, this is our current set of requirements. Let's take a look and see what you have. You're going to need to start X, Y, and Z before you leave your current duty station. And when you get here, because if you don't have this on day one, your kiddo is not going to be able to be enrolled. That can decrease absenteeism and just make that path smoother.
Oh, so even reaching out before you get to that next duty station, find out.
Absolutely.
Typically, you know what school because you're moving into that location. So reach out to them and find out. That's really good. I know a lot of people that do that last physical before they leave, but I never even thought that the vaccine section of it. Yeah, thank you.
Absolutely. And some places have blood lead testing that you have to have at different ages. Some folks it's kindergarten, some folks it's first grade. There are different requirements for seventh grade as well. So it just helps with the navigation of all those different requirements.
Well, we do have some attendees. Do anybody have any questions before we let our subject matter experts go? If not, I think we're gonna move on.
Well, thank you very
Ling,
much.
Dr. Wilmouth?
Appreciate you all.
Thank you for not only sharing your time and your
Yeah.
expertise today, but for the compassionate understanding that you continue to show our military families being part of, at least you, Dr. Wilmouth, being part of one. So thank you very much. Their contact information is here, and they're so nice to go ahead and